Welcome to the SABC News COVID-19 Global Wrap, where we bring you highlights of stories that dominated news across the globe with regards to the coronavirus pandemic. I am Pabalole Phaka, but I'm not alone. I'm with my colleague Busisiwe Khatebe. But before we get into it, let's have a look at some global stats. The global COVID-19 statistics are over 3.7 million confirmed cases, with over 1.2 million recoveries and over 260,000 deaths. In South Africa, the confirmed cases are over 8,000, with over 3,000 recoveries and over 160 deaths. As the country moved from level 5 to level 4 lockdown, citizens were permitted to travel back to their place of residence or the province where they work. This includes people who were stuck in another province when the national lockdown was introduced.
The curfew says 11:59 minutes, 59 seconds. It's cut off. Cut off. If you are still in your province before 12 midnight, forget about crossing to another province. They were given 7 days window period. What made it difficult for them to travel before the cut-off time? I mean, they should have made a plan to travel before the cut-off time. Cut-off means cut-off.
After British American Tobacco South Africa received a letter from ministers of the National Command Council, they abandoned a legal bid against the level 4 lockdown cigarette sale ban.
At this stage, we will not pursue that option that is available to us to go to court on this matter, but rather we thought that this provided us an opportunity for us to work with government, given what the president said sounded like an invitation where it says that government is willing to work with civil society, with government, with all other interested parties to make sure that the implementation of the regulations is a success.
However, the Fair Trade Independent Tobacco Association is set on getting the ban reversed.
We consulted with our legal team following the announcement by the Minister of Cooperative Governance and Traditional Affairs and made the election after thorough consultation and considering our merits that we have indeed a strong case and we're approaching the courts. You will recall that obviously this was not the first instance wherein we had indicated that we would be approaching.
As the labour sector officially opened this week, Labour Minister Thulas Nxesi said that employers need to take measures to protect their employees, as there are concerns over their safety. The minister outlined guidelines for companies to follow, which include provision of sufficient sanitizers with at least 70% alcohol content.
Every employer must notify workers of the content and how it will be implemented. They must inform employees that if they have COVID-19 symptoms, they must not be at work, sick leave, or apply for COVID-19 tests. The employer must appoint a manager from within the existing structure to address the employees and workplace representatives. They must take measures, contact between the workers and the public to prevent the transmission.
On Tuesday, operators of Kulula and British Airways, Comair, announced that it would go into business rescue.
Aviation in South Africa, at the moment, obviously, when we went into lockdown, you had a situation where you went completely from a sort of 100% revenue, if you could say, just before the start of the lockdown to 40% in March and then down to zero basically overnight when lockdown came into effect. So effectively, you've got a major liquidity crisis in the industry where on average airlines have about 2 months of cash. But effectively, on average, probably be running out of cash towards. So we are at a very severe crisis at the moment. The amount of revenue drop is significant to zero, and you're looking at least a 50% over 2019. You have a total of 472 currently was supported by the aviation and travel and tourism pre the COVID-19. And with this crisis at hand now, we're risking losing at least 252,000 jobs with a significant drop in GDP contribution to the country. We had about 180 billion rands contribution to the country pre-COVID-19, and we're looking at that dropping to about 97 billion rand as a result of the crisis. So it's quite significant, particularly on the job side as well, obviously.
The public broadcaster launched a new learning channel this week. SABC Education will provide a public service platform with content from the Department of Education and educational programs currently available on SABC 1, 2, and 3.
Channel basically is in support of all the South African learners. It will carry formal education and also informal education. The idea really is with all the learners being under lockdown, obviously it's affected them, it's affected the learning. So this is a platform for them to be able to catch up with their curriculum. It is in partnership with the based content. The focus is the 11 and 12, yet there will be, early childhood development content. There will also be content from the different grades, all and it's a 24-hour service.
South Africa pledged $1.3 million during a WHO COVID-19 virtual pledging conference with world leaders.
I convey my appreciation to the EU and indeed to Global Preparedness Monitoring Board for convening this pledging conference in response to COVID-19. This is a health emergency of truly global proportions, and I think everyone agrees to that. Yet, developing countries are particularly vulnerable to its impact. We require coordinated as well as consistent international action so that all countries are sufficiently capacitated to be able to deal with this pandemic. We call on all countries to make tangible commitments to bolster the global effort, but in particular to support countries that currently are bearing the brunt of poverty, of weak health systems. And Africa itself has responded to this pandemic with urgency and purpose. The African Union has established a COVID response fund to direct resources towards the continent's response. And to date, Africa itself has been able to raise $61 million from member states, the money that will be committed to helping to fight the pandemic. And as a continent, African countries are supporting each other through regional coronavirus task forces to oversee screening, testing, detection, and diagnosis. Now, South Africa is also making significant investments in science and innovation to fight COVID-19 pandemic. We pledge the capacities and facilities of South Africa's institutes to support the global effort. And in addition to the investments that we've made to these and other research initiatives, South Africa is committing an amount of $1.3 million or 1.2 million euros to this historic pledging conference. We believe that this is a major effort, and with the meager resources that we have, we are prepared to also join in. Now more than ever, the world needs solidarity, and more solidarity, the world also needs cooperation to mobilize and guide investments and to drive delivery towards equitable access to new COVID diagnostics, therapeutics, and vaccines. And I strongly believe that working together, we shall overcome this pandemic.
Meanwhile, the World Health Organization has warned against easing lockdowns too soon.
I want to reiterate criteria that WHO recommends countries consider. First, surveillance is strong. Transmission is controlled. Second, that are in place to detect, isolate, and treat and trace every contact. Third, risks are minimized in special settings
with world leaders
and nursing homes. And other essential for people to go. And fifth, that importation can be managed. And sixth, that communities educated, engaged, and empowered to adjust to the new of returning to lockdown. Manage the transition extremely carefully based approach.
In the rest of the continent, in a COVID-19 virtual lecture, Professor Patrick Lumumba called on Africans, both on the continent and in the diaspora, to unite.
The time is now that you, younger generation, must now take the baton and ensure that all these little organizations that you have created, East African Community, SADC, ECOWAS, Maghreb, Central African Unity, combine them into one so that Africa can be united.
The Africa Center for Disease Control is looking into Madagascar's organic remedy against COVID-19. This after Africa's island nation claimed to have produced a herbal tonic from a plant.
The Africa CDC, as a specialized technical agency of the African Union, has issued a statement, and you can find that statement on our website, which essentially does three things. One is that it recognized that the fact that the head of state of Madagascar gave a presentation of that remedy during a meeting, a video conference meeting with the Bureau of the Head of State, and that was simply information sharing. Second is that after that presentation, we, the African Union Commission, under the leadership of Excellency Commissioner Amira, and I met with the ambassador or the representative of the Embassy of Madagascar to ask for an opportunity to understand more what the remedy is about, and thirdly, to invite the scientists from Madagascar who are driving this process to join our technical working group, which is the African Task Force for Coronavirus Preparedness and Response, so that we can better understand what they've done, what the remedy is about, and they can share data with us.
While the world is dealing with the COVID-19 pandemic, there are other major health crises going on at the same time. 3 countries in sub-Saharan Africa, Chad, Central African Republic, and the Democratic Republic of Congo, are currently struggling with a measles outbreak.
Actually, take note
COVID-19 cases.
The deaths that has 2018 of measles is 140,000. The countries like Central Africa, and Chad are really badly hit by an epidemic of course, it does not reach a lot of work that needs to happen in those particular countries because it's difficult to actually intervene in those countries. And the logistics.
In Africa, confirmed COVID-19 cases are over 52,000, with over 17,000 recoveries and over 2,000 deaths.
And now for international news. The United States of America has recorded over 1.29 million confirmed cases, over 217,000 recoveries, and over 76,000 deaths. In a series of tweets, U.S. President Donald Trump said the White House would not wind down, but would instead add some advisors and center its attention on safety and reopening the country. In one of his tweets, Trump stated, "Gloves, gowns, etc. are now plentiful. The last 4 governors' teleconference calls have been conclusively strong. Because of this success, the task force will continue on indefinitely with its focus on safety and opening up our country again. We may add or subtract people." U.S. Secretary of State Mike Pompeo on Wednesday renewed his aggressive criticism of China, blaming it for the deaths of hundreds of thousands of people for COVID-19 and demanding again that it share information about the outbreak.
China could have prevented the deaths of hundreds of thousands of people worldwide. China could have spared the world a descent into global economic malaise. They had a choice, but instead China covered up the outbreak in Wuhan. Its National Health Commission ordered virus samples destroyed on January 3rd. China disappeared brave Chinese citizens who raised alarms. It deployed its propaganda organs to denounce those who politely called for simple transparency. And that brings us to today, 120 days on. China is still refusing to share the information we need to keep people safe, such as viral isolates, clinical specimens, and details about the many COVID-19 patients in December 2019, not to mention patient 0. Our truth-telling and calls for transparency aren't about politics. It's not about bullying. It's not about blame. It's about the ongoing need to save American lives.
COVID-19 cases in Asia rose to 250,000 on Tuesday, driven by outbreaks in Singapore, Pakistan, and India. The continent now accounts for approximately 7% of global cases, although experts worry that unreported infections are masking the true extent of the pandemic. And in Europe, the United Kingdom has now recorded the highest official death toll in the continent, with over 30,000 confirmed deaths.
Britain has overtaken Italy to report the highest official death toll from the new coronavirus in Europe. Figures released on Tuesday show there have been more than 32,000 deaths in the UK. The high toll could increase political pressure on Prime Minister Boris Johnson, who waited longer than other European leaders to order a lockdown. Weekly figures from Britain's National Statistics Office added more than 7,000 deaths in England and Wales. This raises the total for the UK to 32,313. The figure is one of several methods for calculating deaths, and it's difficult to compare with other countries. But it's the clearest sign yet that Britain could emerge as the worst-hit country in Europe. Opposition parties have raised questions about Johnson's initial decision to delay a lockdown at a time when hospitals in Italy were already being overrun. They also say his government was too slow to introduce mass testing and provide enough protective equipment to hospitals. Johnson himself suffered from the virus and received critical hospital care for several days.
German Chancellor Angela Merkel on Wednesday announced steps to ease the COVID-19 lockdown. She also launched an emergency mechanism allowing for renewed restrictions in case infections pick up again.
Life began to return to normal in Germany on Monday as residents returned to some shops after a month in lockdown. Shops up to 800 square metres in size, as well as car and bicycle dealers and bookstores, are allowed to reopen this week under an agreement with the leaders of Germany's 16 states. It's welcome news for retailers in Europe's largest economy, which has become increasingly reliant on domestic demand.
For the latest updates on the coronavirus, visit sabcnews.com.